Silver nitrate is written on it. This is used to cauterize an umbilicus on a baby. What it does is it dries it, it burns it, dries it, and then it will drop off. It will turn black and drop off. This is a cautery. I'm going to put it on so you can see the red. This is a cautery. And it usually will stay pretty hot until the doctor cauterizes whatever vessel. When you put the lid on, make sure that this goes in between. An ear lavage, we use a 60 cc syringe with a butterfly on the end to go in the ear to press the fluid into the ear. There is also a little cup that will hold the fluid. This one is an ear lavage kit also. This will go into the jug of water. So this will stay in the jug of water and you will just keep shooting. All right. This goes in the ear and there's a barrier so the water doesn't come back on you. This is a sigmoidoscope. Again, you keep the obtruder inside so that you lubricate this end. This will go all the way in up to the sigmoid colon, and they will take out the obtruder and they will be able to see on the side. They will shine a light in here and they will be able to see if there's any lesions, polyps, hemorrhoids, anything that needs to be took care of surgically. Penrose drain. See what it has on the packet, guys?
So we shouldn't get it wrong.
Penrose drain. There's a few. Penrose drain is usually sewn into a wound so it can drain any fluids. All right? So all of it will go in there and they will cut it so that there's about maybe an inch hanging out. And they will sew that into the wound. And then they will put a gauze over it. When they take this out after a week or so, depends on how long and how much fluid's coming out, they will unstitch, take the stitch out that's holding it in and pull it out. And then they will let the wound heal. Emesis basin, kidney basin, same thing. We don't use these a lot anymore because obviously there's not a large amount of space in them. What they use now are bags, emesis bags. The patient's fingers will go underneath so they don't even touch anything to do with the emesis. They will vomit inside. I nearly did it up to my face. When they are finished, you will pull this tube, pull the blue tab out, and you keep this until your doctor says he doesn't want it, and then you will throw it in the biohazard. It depends. You will throw it in the trash. But you will put your name of your patient, the date, and where it was. This is an ophthalmoscope for the eyes. We can look in here and see the back of the retina. The doctor will be the one using this, although the ones we have on the wall, you can use them too. You will use this wheel to get it visual on the retina, okay? There's a little button on here. That's what turns it on. The ones on the wall are a little different. This is the otoscope. There is a speculum that goes on the end here for every patient. You change the speculum for all of your patients. We can also use this to get a foreign object out of the ear. So we can look in the ear, and with our alligator forceps, we can go down here and pull out something because it's going to go straight through. All right? But we, you as medical assistants, will look inside the ear. This is a forceps container. We fill this with alcohol, or not fill, but 2/3 fill with alcohol, and then we put the forceps inside it. So it's just a metal container for small forceps. That's it.
Don't get me in trouble.
All right.
Where am I going to find the other 5?
All right. What we have, are you ready? Mm-hmm. What we have here is a proctosigmoidoscope. These are used for colonoscopies, and the patient is anesthetized with this. This tube, all of this tube, will go into the patient through the rectum, up through the sigmoid colon, along the ascending colon, transverse colon, descending colon. When they are in here, the doctor can turn this to whichever way the bend is going, and this goes left and right. So one will go left and right, one goes up and down. In the end here, the handle is a camera. What they do for the nurse, they have another attachment so the nurse can look at the same time as the doctor is. There are attachments here for flushing, so if they want to flush out anything, they can press on these attachments and it will flush it out. Or they can put air in it. If it's collapsed, they can add air. So this is for a proctosigmoidoscope, and it is for colonoscopies. That's it.